Expects to have those results this fall.
Well, President Biden is expected to meet with 6 governors today to talk about more innovative ways to get more people vaccinated.
In Washington state, vaccination clinics are having a hard time filling their appointments. Now they are requesting fewer vaccine doses from the state.
We sent Elise Haas to talk to a public health official about this. She joins us live. And Elise, what did he tell you?
Jenny, there's a lot of different reasons why they're not seeing this demand. There's lots of different groups, of course. We know the folks who feel like they never want to get the shot, but then there's another group too who just needs those barriers reduced. And that's something that they're working on throughout Southwest Washington. But even though the demand is dwindling throughout Southwest Washington, the public health officials tell me that the rate of vaccination, though, is actually still keeping pace with what we're seeing across the state and across the country. So I want to take a look, as an example, in Clark County at those numbers. So for the first doses, 38.7% of Clark County residents have received their first dose. But another thing to look at is actually by the eligibility, right? So 16 to all the way up to, I guess older folks. So that number actually translates to 48.6%. And that is nearly half of the population, right? Now, if you look at those numbers who are fully vaccinated, meaning 2 weeks out from their final dose, that is 27.4% of everyone. But if you look at the people who are actually eligible to get their shot, that is 34.5%. So county-wide in Clark County, the numbers are pretty good. But the Clark County Public Health Director, Dr. Alan Melnick, says that what he's actually worried about are these large clusters of people who collectively choose not to get vaccinated, and they oftentimes live in the same community, continuing to then the transmission of the virus and the chances for the virus to mutate, like when we saw the measles outbreak in Clark County in 2019.
I mean, if you think about, at the turn of the 19th century, when communicable diseases were the #1 cause of death in the United States, and some of those were vaccine preventable illness, and we've been able to, conquer that, only to come to 2020 when COVID-19 was right up there with heart disease and cancer as the top 3 causes of death. And then people unwilling to get the vaccine. This is what keeps me up at night.
So he explains the biggest challenge in healthcare is preventing disease. People take all sorts of medications all the time when they're sick because they don't want to have those symptoms, or they want to keep themselves from dying from whatever their condition may be. But he says it's harder to convince someone who is not currently ill to prevent said illness. And he says the only way vaccines truly work to eradicate disease is if we all do it together. He really says that vaccines are the best thing that they do in medicine, and it's why, Ken and Jenny, that we get to live the disease-free lives that we live today without polio, Hep B, tetanus, mumps, rubella, measles, you name it, really. So that's something that he says that he hopes that those groups of folks in the county who are against getting the vaccine really do start to consider it.
Yep, okay. Thank you, Elise, for that. Well, KOIN 6's